Okay, I'm going to start. Good evening, ladies and gentlemen. I'd like to thank SADA for giving us the opportunity to use their platform tonight. I'm currently serving as the president of the Dental Therapy Association, and my associate, Dr. Rajeshree Moodley, will be presenting the lecture tonight. A few house rules. Please refrain from using the raised hand, but you may be able to type your comments and questions in the Q&A tab. Certificates will be loaded onto the SADA platform, and you will be able to access your certificates under your member profile. If you are not a SADA member, you will be able to create a profile for yourself and access your CPD certificates. The event for tonight qualifies you for 1 clinical CEU. We are also streaming on YouTube, and that's a live stream, so you are most welcome to watch the event on YouTube if you wish. A little bit of background information about our speaker. Rajeshree Moodley is a lecturer in the Discipline of Dentistry at the University of KwaZulu Natal with a doctoral degree, which is a PhD. Her PhD research was in the field of dental education and occupational health. She first graduated as a dental therapist and worked with the Department of Health. She joined the University of KwaZulu Natal in 2011 as a lecturer in the Discipline of Dentistry and is involved in the undergraduate dental therapy training. I'd like to add at this point that Dr. Moodley was my lecturer at university. Okay, she teaches operative dentistry, dental materials, and dental specialities. She's also actively involved in research and has published in local and international journals. In addition, she has presented papers at local and international conferences. Dr. Rajeshree Moodley supervised postgraduate, master's, and PhD students at UKZN. Her research interests are in dental education, occupational health, and public health. I'll now hand you over to Dr. Moodley. Thank you.
Thank you, Desiree. I'm going to share my screen. Can you see it?
Yes, we can.
Thank you. Thank you, Desiree, for that introduction. Good evening to the panelists and attendees. Today, the title of my presentation is Occupational Hazards in Dentistry, Recommendations to Inform Dental Practice in South Africa. This is an extensive topic, so we cannot cover everything. So we will try and do our best. What is occupational health? According to the WHO, occupational health is a field of healthcare made up of multiple disciplines dedicated to the well-being and safety of employees in the workplace. It has a strong focus on the well-being and safety of employees in the workplace. It also has a strong focus on injury prevention and employee education. It is the practice of identifying risks in the workplace and the prevention of injury and disease. It requires a holistic and comprehensive approach. A healthy workplace is one where workers and management jointly promote the health, safety, and well-being of all workers. Previously, there was a focus on just the physical aspect of the workplace, but now there's a shift to include psychosocial and personal factors into the realm of occupational health. The work environment is now a setting for not just health promotion, but prevention as well. Prevention of work-based injuries. This is in line with the WHO definition of health that defines health as a state of complete physical, mental, and social well-being, and not just merely the absence of disease. An occupational disease is any disease contracted due to an exposure to a risk at work. Occupational health focuses on occupational safety, which pertains more to the physical well-being of employees, while occupational health covers employees' overall well-being. Promotion of safety, improvement of the working environment, work organization, and work cultures is what is looked at in occupational health. There are various occupational health principles that you need to look at work, whether it is in a hospital or in a dental clinic or in a private practice. The avoidance of hazard is primary prevention. The use of safe technology is important. Optimization of working conditions and having all workers safe and free from injury. The integration of production and health and safety activities is critical. The government's responsibility and monitoring of and controlling work conditions is also very critical. The primary responsibility of the employer and the owner of the practice is to make sure that the health and safety at the workplace is under following all occupational health principles. The recognition of employees' own interest in occupational health and safety, cooperation and collaboration of both the employer and the worker should be followed. The right to participate in decisions concerning one's own work, the right to know, and the principle of transparency. So there should be no secrets between the employee and the employer. So in a work-based practice, it is good to employ somebody as occupational health, being in charge of occupational health. So you would choose a dental assistant or a therapist or even a dentist to be in charge of occupational health within a practice. There should be continuous follow-up and development of safety. Here, this officer that you have chosen can do weekly checks to make sure that the practice is following all occupational health principles. Now, at a workplace, you have both hazards and risks. A hazard is the potential for harm or an adverse effect. A risk refers to a likelihood that an injury or an illness will occur as a result of an exposure to a workplace hazard. Now, in dentistry, we have many hazards, and we're going to be discussing that today. And dentistry in the occupational risk pyramid is regarded as very high risk. Hazards in dentistry. The aim of this lecture is to help you recognize different categories of hazards so you can confidently identify them in your workplace. The classification of hazards may differ from article to article or even books because some may overlap, like physical hazards with ergonomic hazards. There are various hazards, and the chemical hazards is what we, the biological hazards has come Now with COVID, the biological hazards are being given a lot of attention. And we're going to talk about this in great detail. Chemical hazards, the detergents we use, the disinfectants we use, chlorine, alcohol, the hydrogen peroxide, mercury, latex, allergies, all are in the spotlight, and there's a lot of research done in this arena. Physical injuries from projectiles, noise, neuropathy, burns, UV light also is being well researched. Ergonomic hazards and the whole layout of your practice is very, very important in order to reduce any injuries. The psychosocial part of dentistry, the stress, workload, job satisfaction, burnout, the medical legal problems, and staff and patient relationships, staff and other staff relationship is critical in having a healthy and happy workplace. Biological hazards are hazards affecting professionals, especially the most recent hazard affecting us is the acute respiratory syndrome coronavirus, causing the coronavirus disease, COVID-19. It can spread via 3 ways: direct or indirect contact, droplet spray, coughing or sneezing, or airborne transmission. Now with the Delta strain, which is 55% more transferable, our work has become more challenging because of the aerosols. Not only is coronavirus something we need to worry about, in our work, the risk of contracting TB is also compounded by the exposure to contaminated aerosols. Having routine TB screening, even in a low-risk area, should be undertaken, and this should also include students. Hepatitis B is another issue to worry about, as this can be transmitted by percutaneous and mucous membrane exposures infected by blood. Needles and syringes may be contaminated. Accidental injuries with infected needles can transmit the virus to healthcare workers, according to Mabubi et al. Therefore, a vaccination is necessary for Hep B. The rubber dam in our practice should be used during dental procedures as it reduces microbiological contamination caused by aerosols by 95%. Also, the use of mouthwashes prior to treatment significantly reduces infections by reducing the number of bacteria in the oral cavity. Aerosols in a dental setting has come into the spotlight. Madden and Day et al. Found that particle debris from air turbines were small enough to reach the terminal alveoli. Dental technicians are at risk of dust-related lung disease. So if you're in a practice doing your own lab work, then you included in that. Droplet nuclei from TB patients are a threat in aerosol. Zamuri, Harrell, and Kobza et al. Found that saliva and nasopharyngeal secretions were laden with influenza, SARS virus, strep, staph, Hep B, and Hep C, and also included fungi. Bashir et al. Found that MERS transmission through droplet was possible in the dental environment. This shows a little bit on prevalence of COVID-19. The data is new and studies were conducted in 2020 where lockdown occurred in many countries. So this could not be a true reflection of data. In the US, 82% of participants were asymptomatic. 6.7% tested positive for COVID-19. Here, 2,195 dentists were participants in this study. And the same researcher, Estrich et al., conducted studies among oral hygienists. There were 4,776 participants, and 3.1% of them tested positive. A study conducted in Italy showed 0.8% that tested positive out of 3,599 participants. In France, a study conducted on dentists showed a 1.9% and a 0.8% prevalence in dental assistants based on serotype. And then prevalence based on symptoms was 11.5% among dentists and 11.8% on dental assistants. What came out of the study, and it's something that we've been noticing as well, is that depression and anxiety was noted, and this was expected due to the loss of income, uncertainties, and stress. How do we prevent the spread of COVID in our dental practice? You will be safe if you wear a good mask, a good face shield, and clinical PPE. Many studies have shown that wearing an N95 mask keeps you safe. Wearing a double surgical mask with a face shield and clinical PPEs also keep you safe. Your surfaces and stationery in your practice needs to be sanitized thoroughly after every patient. Your instruments need to be autoclaved, but this is something we're doing all the time. Your pre-appointment changes should be made. With regards to payment in practice, maybe payment should be collected prior to your appointment if that's possible. Screening your patient before the appointment by making them fill out a form before they get to your practice. This is not possible in hospital practice, but can be done in private practices. And then your pre-procedural rinse can be practiced. During the procedure, using a high volume suction, and we're going to talk about this at the site of your procedure, helps with reducing the bacterial and viral count around the practice. Your post-procedure care needs to be thorough, especially when you're doffing and donning. If you're doing this in your treatment room, then you are at risk of COVID because of the aerosol remaining between 1.5 and 3 hours in that surgical room, especially if you don't have proper ventilation. The circulation of air is critical. So we're going to talk about that further a little later. Controls with airflow, a lot of work. We've been listening to a lot of webinars regarding this. So we need to engineer controls within our practices. As discussed previously, rubber damming reduces contamination caused by aerosol by at least 95%. So does pre-rinsing. That also decreases the viral and bacterial load in the aerosol. Dental ventilation guidelines. Air change per hour corresponds to air volume added or removed from a space. If you want proper air change, air ratios should be maintained. 80% of aerosols are removed from the environment if you have proper air control. If you cannot afford HEPA filters or high volume evacuation equipment, windows open on either side, getting proper airflow keeps you safe. So in the South African setting, not all practitioners can afford the HEPA filters and air purifiers. So ventilation works well as long as you have air coming in and flowing out. So from a practical point of view, your high volume suction, if working well, keeps you safe. If your dental assistant hold it close to your handpiece, it reduces the viral count in your surgery. Now, studies have also shown that air filters containing high efficiency particulate arrestor, which is the HEPA filter, keeps your surgery safe by reducing 99.97% of bacteria in the airflow. HEPA filters have also efficiently reduced concentration of airborne particulates. So if you can, this would be an option. Carbon filters also limit allergens in a practice. It reduces mercury vapor in a dental surgery as well. Now, besides the biological hazards, we also have chemical hazards in our workplace. And exposure to chemicals in the workplace can cause acute and long-term detrimental health effects, according to Bunchner et al. The types of chemical hazards in dentistry: gloves containing latex may cause allergic reactions, but dental materials, detergents, lubricating oils, solvents, X-ray processing chemicals also can lead to allergic reactions. So you need to work with these with gloves on. Latex, mercury, nitrous oxide, acrylic resins, ethylene oxides are also considered. Showed that 54.1% of dental practitioners in KZN never use dental amalgams, while 26.1% sometimes use it. So I think with the reduction in the use of amalgams, practitioners are a little safer. Nitrous oxide gases poses a health hazard. Liver diseases, renal issues, neurological issues, spontaneous abortions were also seen in the literature. To protect workers from health risk associated with nitrous oxide, operating rooms should be equipped with scavenging systems to remove this from the surgery. The ideal would be, according to Buradar and Narayan, would be to have a separate room when working with nitrous oxide. Acrylic-based resins also pose a problem with contact dermatitis. Monomers used in dentistry have problems with cytotoxicity and may also cause eczema. So does impression dental materials, which also have cytotoxic potential. Ethylene oxide that is used for sterilization of dental equipment also pose a problem. And if there is long exposure over a long period of time, practitioners may show signs of respiratory irritation, lung injury, nausea, headaches, dizziness, and sometimes convulsions. Sterilizing agents like aldehydes and phenols also pose a problem. Now we discuss physical hazards. There are various physical hazards in dentistry. It seems like we work in a very hazardous place. I would be scared with all this information. So there's radiation effects to worry about, high-speed projectile, noise, lasers. We need to engineer control to mitigate these physical hazards. Physical hazards are a common source of injury. We're going to be discussing each one in great detail. Radiation. Now, something we all learned at university is the ALARA rule, right? Which is the golden rule in radiation protection. It is to protect the patient, but it can also be used to protect the operator. It stands for as low as reasonably achievable. This principle means that even if it is a small dose, if receiving that dose has no direct benefit, you should try and avoid it. To do this, you should follow three basic principles, which is protective measures in radiation safety. Those are time, distance, and shielding. So very often, if we have a patient who cannot hold the X-ray in place, then we hold it and ask the assistant to expose. And this is incorrect because if we follow the ALARA rule, we should not expose ourselves to any radiation at all. High-speed projectiles. This is rare, but it happens. Physical and mechanical hazards can include eye injuries resulting from projectiles, cuts from sharp instruments. Injuries can result in the transmission of serious infectious diseases as well. So we should wear eye protection every time we work. But now with the COVID-19 virus, we are wearing eye protection every day, and we should continue post-pandemic. Our equipment should be serviced so we don't get injured. When it's old, we should replace it. Look at replacement guidelines. Equipment don't last forever. Our safety is important. We should use PPEs to protect ourselves. We should wear eye protection, and I've mentioned that before. And we should also cover and have enough legal cover to protect us should an injury arise with one of our workers or our patient. Here is a picture, also a rare occurrence of a case study done in Sri Lanka, where a piece of a burr flew out while the dentist was working and went through the chin and landed in the soft tissue in the vestibular area. Prevalence of eye-related diseases in dentistry. Around 50% of eye-related problems occur in most of the studies that I've looked at. And researchers recommend that eye protection awareness should be increased. Eye protection should be worn. There are various eye-related hazards, from aerosol, bacteria that can cause conjunctivitis and other eye infections, the use of lasers as well, and we're going to discuss that in greater detail, the risk of projectiles, we spoke about that already, and curing light, which we're going to discuss in detail. Now, there's something that dental operators are at risk of, which is dry eye syndrome, and it's related to a reduction in blinking. Because you're focusing and concentrating on your work, there is decreased tear production, increased tear evaporation, and there is excessive lighting around you, air conditioning, heat, leading to eye conditions. So using an eye drop to hydrate your eye every day would be a good solution. Noise in a dental practice. The acceptable, permissible workplace noise in an 8-hour shift is 85 decibels. So ear protection is like active noise cancellation earplugs is important. Noise is not only the source of occupational hearing loss, but it is also exposure to chemicals such as solvents, mercury, that can also cause problem with hearing. Hearing problems are increasing according to Anjum et al. 2019 because of vibration noise from the handpieces and noise producing devices in the dental practice. According to the National Institute for Safety, Occupational Health and Safety, the prevalence of noise-inducing hearing loss is very high, and both auditory and non-auditory effects are being seen, like sleep disturbances and hypertension. So continuous exposure to noise affects learning performance, increases annoyance, and reduces and creates a reduction in efficiency in work. So the daily permissible noise level, as I mentioned, was 85 decibels. In dental clinics, the highest noise produced by the micromotor handpiece was 92.2 decibels. The lowest was 51.7 decibels created by the ultrasonic scaler, but this was without the suction pump. Dental drills range from 56 to 88 decibels. So when you're buying a handpiece or you selecting a handpiece for a practice, you need to know what noise is generated by this handpiece because you need to protect your ear from problems. Lasers in dentistry. So despite FDA approval, no laser system has received the American Dental Association's seal of acceptance as an alternate to more dental treatment. That seal assures dentists that the product or device meets ADA standards of safety and efficiency. So the ADA, however, states that it is cautiously optimistic about the role of laser technology in the field of dentistry. The thing we need to worry about is the airborne contaminants or smoke or vapor generated from the surgical site, and that is of concern. This is also known as the laser plume. Ms. Serendino et al. Stated that airborne contaminants can be controlled by ventilation, evacuation, and various methods of respiratory protection. So wearing your PPE, your mask, your eye protection keeps you safe from this as well. Also, you need to protect your eye with the special glasses and your patient as well, including your dental assistant. The LED curing light, the curing light used to cure your resin-based restorations and fissure sealant and adhesives. You need to test your filtering device. So your orange filter, you need to test it to see if it is working optimally. How you do this is you take a 6mm disc of a resin-based material, 2mm thick, you put it on a pad in a dark room, you place your protective filter on it, that little orange filter, and then you cure your composite over the filter for 20 seconds. Move your filter. If your composite has started to set, that means that filter is not working properly. Blue light causes retinal injury, and this takes place from exposure to a wavelength of 380 to 550 nanometers. And the sensitivity of the retina peaks when you use a light that ranges from 440 nanometers. Now, dental curing units work at around 440 nanometers. It's been shown that under certain clinic conditions, the light emitted from this causes photochemical retinal exposure, especially over an 8-hour workday. So blue light filtering eyewear should be used. The curing tip should have a mounted shield to keep you safe, or you should use a paddle shield. Using quality eye protection is good, and it's recommended for all procedures using the curing light. Research performed by the American Dental Association, they tested 22 protective filtering devices, and out of that, 9 were not good. A similar study was done in the Nordic Institute of Dental Materials, and only 9 out of 18 protective filtering devices were shown to demonstrate filtering capacity. So you need to test your filter, your paddle filter, or your shields that are attached to your curing light to see if they're working well. Sharps in dental practice poses a risk for percutaneous injury. This is an issue. In Mumbai, 45% of dentists had some sort of percutaneous injury in a study done by Ramaswamy. Brazil also showed 59% of dental assistants and 20.8 dentists having some sort of percutaneous injury. In a study done by Moodley et al. In 2017 among dental therapists, oral hygienists, percutaneous injuries were seen among dentists, therapists, and oral hygienists. So we need to protect ourselves. Percutaneous injury exposure was also researched among students at a South African university by Musikene et al. And it was found that students, 8% of them did not report injuries. The periodontal department was at risk, and so was the maxillofacial department. The main tools for injuries were the needle with a 52% prevalence, while the scaler had a prevalence of 31%. The most common contributing factor that was reported was lack of concentration, anxiety. So when you are injecting, you need to be careful, you need to focus, you need not to be anxious, and make sure that no one around you can get injured. Very often, the operator leaves an unopened needle for the dental assistant to recap. This should not be practiced because it puts other people at risk. Pain prevalence among dental practitioners. Musculoskeletal disorders, neck pain, hand pain, shoulder pain is very prevalent among dental practitioners. Studies done in South Africa by Govender and Langwane et al. Govender and Langwane in 2018, they looked at 2 public health facilities, and they found around 50% prevalence of neck, shoulder, and lower back pain. Studies conducted by Moodley et al. Also showed pain prevalence among hygienists of 70% for neck and 56.5 for hand pain, respectively. Dentists reported the highest prevalence of shoulder pain, which was 55.8%. Percutaneous injury was also seen among this cohort. Ergonomic hazards. What is ergonomics? Ergonomics in dentistry should strike a balance between keeping the dentist or therapist or hygienist healthy while providing efficient treatment. Ergonomics means preventing musculoskeletal problems by enabling the operator to adopt a more neutral position, a more comfortable position, and achieving patient-friendly treatment, improving treatment efficiency, and achieving treatment while achieving treatment accuracy. So an unnatural posture will be a problem for physical strain and repetitive strain injuries. The potential for these injuries are higher if you do not follow good ergonomic principles. The aim of ergonomic health is to have an oral health worker working for many years, pain-free and productive. Your head position should have a slight inclination, which is between 15 and 20 degrees, not more. Your torso should be upright. It should promote the natural curves of your spine. If needed, the backrest of the chair can be positioned to give you proper lumbar support. Your upper arms, your elbows should be relaxed. Your elbows should not stick out. They should be close to your body, and that is more relaxed. Shoulders should be orientated over your hip. You should be in a relaxed position. If you're working with your hands higher than your elbow, you need to change your procedure when you're working with the next patient, because what happens if your hands are higher than your elbow, there is a decreased blood flow to your hands, to the neural tissue in your hands, and you are at risk of getting carpal tunnel and other hand related problems. Your wrist should always be in a neutral position. Your pinch grip should not be tight, because this also impacts on your hand and wrist. Your seated posture, your knee should be relaxed slightly lower than your hip or in line with your hip. Your foot should be flat on the floor. If you are using the rheostat, which is the foot pedal, and this alters your position, then you should change your hip position often to adjust so you don't have any injuries. So you should also consider alternating job tasks from sitting, standing, doing varied work, restorative work, surgical work, scale and polish throughout the day. So this changes the function of muscles, and different muscles function for different procedure. Another way of keeping healthy is by doing weight training, yoga, Pilates. All that helps your hands, shoulders, neck to get stronger so you can prevent these sort of injuries. Magnification loops is a good idea because it helps you maintain good posture. So you're not bending to look because you cannot see properly. So it is proven that while using loops or a microscope, a dental operator can keep optimal distance. So you're actually protecting yourself as well. When working without a dental assistant, like in this case, which you shouldn't, because the ideal, it's ideal to work with a dental assistant. But if you cannot afford one, then you need to have your workstation arranged accordingly. So all the things that you use occasionally should be in front of you. So you don't rotate your hips and rotate your neck in order to deliver these instruments to you. But it's been proven that four-handed dentistry is optimal because you share the load. It's shared between two people. Visibility is better. Your treatment is more accurate. It's less exhausting. Your muscles are more stable. The ideal, if you can afford, would be six-handed dentistry, but not many practices can afford this. A left-handed operator is at greater risk. They should work with a left-handed dental assistant or an ambidextrous dental assistant because they're more at risk. The choice of instruments is important. So when you buy instruments, you need to understand that instruments got to be light. The general recommendation are instruments that best suit you. A 3mm diameter is okay for your examination instrument like your mirror or your explorer. But when you're working with instruments, hand cutting instruments, you need to have a diameter of at least 10 millimeters or a weight of at least 15 grams. This helps you pinch grip the instrument properly. Diameters larger than 10 millimeters have no additional benefits. Alternating tool diameter is good for your hand. So having silicone instrument handles also further improve hand comfort, reduce hand fatigue, and improve your pinch grip and strength. So when you are working with instruments, you must have a fulcrum or a finger rest, whether it is orally or extraorally. This takes pressure off your hands as well. It is important to have a stable working hand during treatment, as this prevents musculoskeletal injuries. Also, when you're selecting gloves, it's better to choose a glove that fits you well rather than that ambidextrous glove that comes in a box and one size fits all. It's a problem if a glove is too large for you because when it gets wet, you can't hold instruments well. There's a risk of slipping and there's a risk of musculoskeletal problems because you increase your grip. So also, if gloves are too tight, then this could be a problem as well. Wearing personal protective gear can also put you at risk. It's an ergonomic risk because sometimes you cannot work well with them, you're frustrated. And during COVID times, suddenly people had to wear shields and gowns and hats and filters, N95 filtration masks, and this was new to you. So the recommendation is to try and test these out. So before you work with something, work in a practice with no patient. Move your chair, seat yourself. Try to practice with this in order to get used to it before you have a difficult procedure, a difficult patient, and then try to work with PPEs. So it's good to practice with this. Practice with your lighting, practice with the equipment so that you can have improved access when you have the patient on the chair. Now, besides chemical hazards, biological hazards, there are various psychological hazards in dentistry as well. So workloads, excessive workloads is a problem. job satisfaction, burnout, medical legal problems, staff-patient relationships, all these bring a lot of stress in a dental practice. So Acharya, in his study, highlighted that major stresses among newly qualified dentists were seen in dental practitioners and even undergrad students. And it is proposed that the ability to identify, perceive, and manage attributes for dental workers. Burnout is characterized by professional exhaustion. And burnout is seen very often among oral healthcare workers. It is also characterized by a loss of enthusiasm for work and a low sense of personal accomplishment. And a lot of stress and burnout is happening during the pandemic. Both the personal and educational environments are causative factors of stress. Students in many studies perceive that workload and self-efficacy influenced burnout when they were students, and this is transferred to them in practice and in their many years of practice. 394 students in a Colombian study experienced burnout. So what happens to young practitioners and practitioners who have practiced dentistry for many years? This stress and burnout continues. So we should have programs where dentists, therapists, and hygienists learn how to deal with stress and burnout. Teamwork, Evans et al., 2010, said one of the stresses were a lack to work as a team. Teamwork skills need to be taught from university days. There are a lot of practitioners who cannot function within a team. And what a beautiful thing it is to work in a well-managed team where there's task sharing, where there is workload sharing. So if you work in a practice with specialists, dentists, therapists, and hygiene, there is work sharing, work satisfaction, there's less stress, less burnout. I hope people agree with me, unless there is staff and patient and human relationship issues that come into play. So Evans et al. Said working in a team reduces stress, creates a sense of value for workers, learning together for oral healthcare students will foster teamwork. Rafik et al. In his study said students and dentists should be prepared for and they are confident when it comes to restorative dentistry, preventive dentistry, but when it comes to practice management and teamwork, they lack these skills. So newly qualified dentists, therapists, hygienists are at risk to stresses because of their lack of practice management skills, lack of teamwork skills, lack of dealing with stress and burnout. So as a suggestion, dental curriculum needs to be looked at. A teamwork study was done in the United Kingdom, and it showed that dental therapists felt less valued, less supported when they worked in a full dental team. So this differs from what I said previously, isn't it? However, in some cases, the dental therapists felt that dentists were not listening to them and were giving them preventive work rather than restorative work. The dentist did not know that the scope of the dental therapist in the UK included restorative care. So working in a teamwork, understanding each other, understanding what a dental therapist is, what a hygienist is important. And not being valued in a profession adds to stresses. Moodley et al. In their study found that job content, lack of variety of work, underuse of skills, uncertainty of work were psychological risk factors associated with the practice of dentistry in KZN. Furthermore, the lack of control over workload exacerbated the situation. The added stresses included the environment, the equipment, heat in clinic, noise, lack of space, poor organizational structure, communication by management, lack of support. The researchers Moodley and Van Wyk in this study also found that dentists in the public sector perceived that the dental practice was more demanding, and Hakkinen et al. Also concluded that improving work environment can enhance the feelings of vigor, dedication through job enrichment processes and CPD activities. Safety hazards in a workplace. There's lots of electrical hazards. So your safety officer should walk through your practice looking to see if there is any electrical hazards, gases that are hazardous, that are exposed, working with water, lasers, curing lights, and cords sticking around could be a problem, a potential problem. When it comes to safety, the person who is at risk for injury must be aware of the hazard and what can be done to control the hazard and prevent injury. This is one of the 3 E's of safety. Evaluation, education, and enforcement will keep you safe from electrical hazard, gas hazards. So looking at wet floors, keeping sign when floors are being cleaned, the choice of paint when you are selecting paint for your walls in your surgery is critical because volatile organic compounds can be released from paints. So when you're researching paints for your surgery, your new surgery, make sure you look at a paint that could be safe because over time, these chemicals can be released into the air called off-gassing, putting you at risk. So, self-care is critical in our work life. It is not selfish to love yourself, take care of yourself, and make your happiness a priority. This is necessary. So do self-care activities, walk, gardening, take a walk on the beach, take a walk in a park. This is all important for you to be a healthy, happy practitioner. Weight management, your abdominal girth puts you at risk to musculoskeletal disorders, especially lower back and middle back injuries. With the increase of your abdominal girth, you are more prone to having back injuries. So do yoga, exercises, meditation, Pilates, strengthen your muscles, strengthen your hands, strengthen your back, so you're less at risk of musculoskeletal problems. Protect yourself, keep your practice safe, make informed choices. So in conclusion, posture, work analysis is integral in clinical training, is integral in your practice. Occupational health and safety in dentistry is central to creating a safe working environment and ultimately safe dental practice to prevent work-related conditions and injuries in the future. Lastly, I'd like to say, doing things that make you happy. Self-care is giving the world the best of you, not what's left of you. Thank you. This is my references, and thank you for your kind attention.
Thank you, Dr. Moodley. There are a few questions that are that's been sent on the chat.
Please stop sharing.
I'm not sure if you want to answer them. The first question is, what is your opinion on suicide amongst dentists? Is this considered the result of the occupational hazards that dentists are exposed to, including the persistent mental and psychological stresses associated with the profession?
Okay. Previously, suicide rates were highest among dentists. Now it's being taken over by policemen. So, but we are still at risk. And like the research I've mentioned, with COVID, with stresses, with dentists still have to pay their rental. They still have to pay for the costs of running their practice, pay staff, etc. So they are at risk of stress. They're highly strung. I don't have prevalence rate of suicide among dentists, but I can email the delegate with that information if I could get it.
Okay, thank you for that answer. I am sure the delegate would not mind sharing that email information with us for the information that she or he requires. The next question or comment rather, this is a comment from Mark Gilman. It says provided, I think it's with reference to the nitrous oxide research that you've done. It says provided adequate scavenging is used with nitrous oxide, it is not hazardous.
Okay, so thank you for that comment. That's true. I did mention in my presentation that using scavenging equipment and also using a separate room for nitrous oxide sedation processes would be a good idea. So thank you for that.
This next comment states, the entire tone of your presentation spells doom and gloom. It's tantamount to swimming in the cold waters across the bay of the shark-infested False Bay. I always suspected that dentistry can kill. Should I encourage my daughter to become a dentist?
Why not? If we keep safe, we're aware of the hazards, we take precaution, you exercise, you run a practice that's safe, you worry about your number of patients, you schedule task shifting like restorative procedures, MOS procedures, scaling and polishing procedures. You alternate from standing, sitting, working in different postures. You buy equipment that keeps you safe. You look at your handpiece before you buy it to see that it works at correct decibels. You have ear protection and you use that. You will be safe. Sorry if my presentation created doom and gloom, but that wasn't the intention. The intention was to make you think about these hazards, because very often new practitioners, somebody would sell a handpiece to them and they're not cognizant of the fact that they must worry about noise, vibration, and all those factors. So it's really nice that we have CPD activities where these practitioners can listen and be cognizant of these within their own practice. So I will not discourage people from studying dentistry, dental therapy, or oral health. I hope that answers your question.
So the next question, have you taken the initiative to educate the powers that be in the public dental service to implement all that you have presented this evening? Such a move would be an excellent way to improve the working conditions of public health sector dentists. They should perhaps implement all this when the situation of the national fiscus makes a turnaround. Otherwise, this whole thing becomes an esoteric academic exercise.
Oh, thank you for that comment. In fact, we should have an occupational health organization for dentistry in South Africa. We should actually lobby for this. And there isn't any position paper that is just categorized for dentistry. Dentistry features within the occupational health documents in South Africa, but not just for dentists, therapists, and hygienists. So thank you for that comment. It is about time, and maybe SADA, SATA, or HASA should lobby or start this process.
Thank you. The next question, oh, sorry, I think this is a comment and a question together. A presentation quite enriching. Thank you, Dr. Moodley. Regarding chairs, perhaps we also need to explore the use of saddle chairs for operators. After using the chair for a week while doing a locum at a friend's practice, I now prefer to perform all procedures standing when working elsewhere. Okay, that's interesting.
Okay. Well, thank you for that. That's really interesting. So what I didn't mention in my presentation was chair selection. So basically a dental chair, your operator stool should have 5 caster wheels, should have proper back support, should saddle your back properly. There are chairs that don't have back support, but keeps you in a good posture. You can explore that, but standing for all procedures, the entire day puts you at risk for many occupational health problems, especially back problems. You need to alternate between standing and sitting, as I mentioned in my presentation. So it would be good that you invest in a good chair. You can stand when you're doing minor oral surgery, or you can stand when you're doing a scaling and polishing, so you can maintain that distance from your patient and protect yourself, but you need to vary your work from standing, sitting position. If you stand the whole day, you're going to have problems with your feet, ankles, knees, lower back as well. So you need to have varied positions during your day of work, because it's very often some people want to book all cases where you stand the whole day, and then the next day the restorative cases. We should alternate for our musculoskeletal health. Also, exercising, back care, all that is integral to musculoskeletal health. And if you do your varied work and you exercise, you should have good musculoskeletal health. I hope that answers your question. Thank you for the question.
Okay, so the next question, for those of us who are new graduates, how can we get our, I think they meant CPD certificates? You need to log on to the SADA website and sort of register. And I think that's how you get your certificate. I will clarify that with SADA. This is a comment from Dr. Shanuka Singh. Well done, Dr. Moodley, an excellent presentation.
Thank you, Prof. Singh.
Then there's another comment. Okay, thank you. How do we get the certificates? I attended on Tuesday's session, but I don't know how to get the certificate. Okay, I think you need to log on to the SADA website for that. Somebody made a comment on varicose veins, and that's just a whole in capital letters. So I don't know if you want to make a comment on that, Dr. Moodley?
Yes, if you stand and work, you are at risk, but you also need to worry about whether you have other medical conditions. Now, there are some people that are at risk to varicose veins problem, whether you're a dental practitioner or not. So you need to establish whether you have a problem with leg veins, and it's very, very common. But if you stand throughout the day, and if you're on your feet throughout the day, then you are at risk of getting spider veins, which is the little veins, and the varicose veins as well. So if at a certain stage you're showing signs of this, you should see a vein specialist, because you could use something to prevent this from getting worse, like vein stockings, etc. But this will need intervention from a medical practitioner. But remember, if you're on your feet, you are at risk. Thank you for that question.
Okay, so I have more clarity on the question regarding the CPD certificates. It says, yes, they need to create an account. We will upload them on their profile, but as we ask, can they please allow for a period of 5 days after the webinar to access the certificates? They can also email SADA on events@sada.co.za, or you can call 011-484-5288. I hope that information helps. There's one more question. I see a few raised hands. If you can, please type out your question so we can read out the question and answer it. The next question. The BHF rates are so low. I have been in practice for 30 years in a town. I have started overlooking my own health and clinical and safety clinically in order to make ends meet and pay my my practice overheads. Is this common in South Africa?
Thank you for that question. Yes, it is. I know for a fact that some dentists, therapists, and hygienists work without a dental assistant. So cutting corners is what's happening in South Africa. Unfortunately, it's not easy to be in practice. So you shouldn't actually overlook your own health. You should worry about your health, because if you don't work, if you're not in your practice, you go home ill, somebody else takes over your practice. You cannot be replaced in your house, in your family. So your health is important. It may not be, you may not think it's important, and your practice is more. But your family at home wants you healthy and happy. And I'm sure if you take cuts in your practice, earn a little less, and think about your health, having an assistant, you don't need fancy equipment to be healthy. You need to cut down on your hours. When I researched dental therapists and hygienists and dentists and the hours of work, it was shocking. Some practitioners work for 7 days a week from 8 to 4 and sometimes longer hours. They never took a break. Over 50% of them worked Mondays to Saturdays. So Sundays is your time with family, running errands. Where's the time for self-care? So you need to factor all that in, because I believe that you are irreplaceable. In the greater scheme of things, yes, you in practice, you're going to be making more money if you cut corners, but is that worth it? So think about that. I hope that answers your question, Maria.
Okay, thank you. The next question. This is actually a comment. It says, wonderfully researched and presented webinar. Thank you very much.
Thank you, Dr. Ravina Naidu.
The next comment or question rather, can you recommend the correct height of the operating table for surgery?
Okay. That depends on whether you're standing or sitting. Okay, so if you're standing, your patient has to be at heart height, your hands straight, your elbows close to you. So depending on your height, the patient should be at the height of your heart and working comfortably with your elbows close to you and your hands parallel to the floor. Then you're comfortable. So you raise the patient according to that height in a supine position. But also here again, what works for you? If you're working on the lower quadrant, the patient head should be raised slightly. If you're working on the upper quadrants, then you want your patient's head tilted back. So also that all should be factored in when you are having to set your patient's position on the operating table. I hope that answers your question, anonymous
Thank
attendee.
you. Thank you, Dr. Moodley. Yes. The next question. Thank you, Dr. Moodley, for the wonderful presentation. I have been practicing dentistry for over 15 years, and even with being careful with most of the risks, it is impossible to avoid them all permanently or to work in a completely risk-free environment. And eventually the occupational risks will catch up. At this point, I have to seriously reconsider my dental career due to the various musculoskeletal problems. What options do we have if it so happens that practicing dentistry becomes impossible?
Oh, I'm so sorry to hear that. Yes, musculoskeletal problems increases the longer you practice. We are all at risk. Taking precautions from the time you're young is important. It's not impossible, but some people are at more risk than others. Like I mentioned, left-handed dentists, female are more at risk. Your muscle strength, your body shape, your abdominal girth, all those are factors that predispose you to musculoskeletal disorders. So there's no foolproof practice where I can say you're not going to get these risks. But if you're having a problem, the research says don't stop practicing. Reduce practice, get a locum in, and then wean yourself back into practice. Once you have physiotherapy, physical therapy, you should wean yourself back into practice and see whether that works. That seems to be what helps many practitioners who have a problem. So if your practice is a success and you're doing well, but you've got musculoskeletal problems, get somebody in to help you. Do what you can do. If you don't have pain during S&P procedures or restorative procedures, but you have pain when you're doing surgery, get somebody to help you until you can do this. So make changes within the practice, make changes within your time in practice and see whether that helps. But quitting is not the ideal because then your muscles will get lazy and you wouldn't be able to go back. So see a physiotherapist, see an occupational health doctor and see whether they can help you. But my advice to you is don't give it up completely. You need to be weaned back into practice once the pain stops. I hope that answers your question. I don't have all the answers.
Okay, the next comment, it says, great and informative presentation, Doc. I am more than amped to work with you further. Okay.
Oh, thank you for that.
Then, yes. The next question, the cost and time factors involved in having to fulfill all risk prevention is impossible. How do you suggest this be done?
In my presentation, I did mention the ideal is a HEPA filter. But if you don't have it, then have cross ventilation. Because if the air is moved from the surgery, you're not at risk. So if you don't have a fancy vacuum in front of the patient's face, but if you have a dental assistant holding the high volume suction and you work well with this, aerosols can be reduced. Rubber dams are cheaper. So you don't need a HEPA filter if you use high volume suctions and rubber dams. So work according to what you can afford and what is safe for you. I know it's impossible to have this first world practice with HEPA filters and high volume evacuators and the best handpiece. It's impossible. Not all of us can afford this. We in South Africa. Okay, so do what you can. But the idea is be safe. Your body should be safe and free from injuries. You should be free of biological hazards. Now, if you look at the research, COVID in Italy and the dentists, there again, we can't go by that research because there were lockdowns, dentists were not in practice, but the levels were quite low. So we don't have research, we don't have any prevalence data among dentists, therapists, and hygienists in South Africa. There's a gap for research now for somebody to do. Desiree, maybe you. I'm just joking, but yeah. So we can't have the first world practice we all dream for, but we can make changes. We can make informed changes, use the cheapest as long as it works for us and it keeps us safe.
Okay, I've got a comment with a lot of question marks from Norman Clement. It says, what about playing golf? Is that a good recommended exercise and mental relief?
What a lovely statement. I'm going to play golf with Norman. We need to have a date. Just joking. But yes, golf is out in the sunshine. You're out in a peaceful environment. You're out for the entire Sunday. You've left your wife and kids at home. What a life. I mean, that is pure self-care, isn't it? I always say golfers, they're selfish because they've gone out for an entire day just thinking about themselves. So how nice. Yes, I think it's the best interaction, the best way of reducing stress. So I think I need to take up golf. Thank you for that comment.
Okay, there's another question from Rashmika Ramdas. Dr. Moodley, amazing presentation. I am a left-handed dental therapist and find it difficult to find resources to accommodate me. Are there any options available that will assist me? Thank you.
Okay. Rashmika, I will send you an article about left-handed operators and what can be done. So I will email you. If you could WhatsApp me your email address, please. Thank you.
The next comment is from Shamila Bassoon. Well done, Dr. Moodley, on an excellent, well-researched presentation. Doom and gloom exists in almost all occupations, not just dentistry. A healthy balance between professional and personal care will make the career more rewarding. Okay.
Excellent comment. Thank you, Shamila Bassoon. I could have not said it better. Yes, every occupation has problems. So leaving dentistry and going to something else, you might be leaving the frying pan to fall into a braai, maybe. I don't know.
The next comment.
But thank you for that.
I've just moved up slightly too much. Okay, the next comment. Thank you for the informative lecture. Is there any South African study on autoimmune disease amongst dental practitioners due to chemical exposure?
Oh, that's an interesting question. Thank you. But I didn't read about chemical exposure, but I read about COVID and autoimmune diseases, that patients with autoimmune conditions are more at risk and the virus stays viable for longer in patients with autoimmune diseases. I need to look at this, and if this delegate, Elizabeth van der Ham, could email me, and I will look at this and send you some information, but I cannot answer your question live. Apologies, I'm sorry about that, but that's a very interesting question, and I will definitely read about it and send you info. Thank you.
Okay, the next question, any comment on lung complications related to dentistry?
Any
Any comment on lung complications related to dentistry?
Yes, mercury is a problem. Those volatile chemicals we spoke about is an issue. And the long-term exposure to all these aerosols and disinfectants that we're using now is not understood. So we don't know what's happening to our lungs. I know dental technicians working in an environment full of dust, they're at risk of lung disease. So if you're working in a practice where you're cutting acrylic dentures, using sand and models and grinding them, you are at risk for lung disease. So you need to take special precautions, using a dust mask and a visor, having extractor fans, etc. But lung disease is an issue among dental or oral healthcare workers, rather. Thank you for that question.
I think this is our last question. The rest are all comments. The last question is, can you explain what six-handed dentistry entails?
Six-handed dentistry.
Six-handed.
Sorry?
Can you explain what six-handed dentistry entails?
Sorry. Okay. When you have four-handed dentistry, you working together with an assistant. So if in the same room you have another assistant helping, it eases the workload of your dental assistant. So you've got, especially when you're doing periodontal surgery, if you are working with in a maxillofacial practice where you need instruments passed to you, then having an additional hand, which is the fifth and sixth hand, is important because it takes away the pressure from you, your assistant, and you have basically a runner helping you with calming the patient, passing you instruments, taking care of things around you as well. So it works well if you're doing procedures like periodontal surgery, implants, maxillofacial surgery, wisdom removal, and all that. So if your assistant is directly helping you, somebody else helps you. So it eases the load, it creates better flow, but there again, it costs you because you need to employ another person. Thank you for that question.
Okay, I think we only have time for one last question. In your presentation, you mentioned something about developing eczema. I would like to know which chemical in dentistry can lead to that. I have suspicions that I'm suffering from eczema, which developed recently.
It could be the latex, the gloves. If you change the brand, look at that. It could be processing chemicals if you're using it. But if it's recent, it could also be your sanitizing liquid that you're sanitizing your hands every day with. Now that there's COVID, aren't we all just using so much of sanitizer? And there is a risk of eczema with these alcohol-based sanitizers as well. So maybe use one that is glycerine-based that also moisturizes your hands while the alcohol kills the viruses and bacteria on your hand. So I hope that answers your question. Thank you.
Can you take one last question?
Okay.
Okay, this comment is from Nikesh Das. Great presentation. Are there any occupational hazards associated with wearing N95 masks?
That's a very good question. I haven't looked at that. But when I mentioned ergonomic risk factors, I mentioned PPE and getting used to the PPE. Getting used to N95 mask is an issue for a lot of dental healthcare workers, including me. I used to use a double surgical mask, and now when I put a surgical mask with the N95 mask, initially it is a problem. So I don't know. But that would be an interesting study. I can't answer that. I'm looking at decreased oxygen levels, your breathing being affected. So it's something to look at. So that is a brilliant comment. I'm definitely going to read about it. And Mr. Nikesh Das, I will email you if you send me your email address, and I can maybe read about it and give you input. But I can't answer that question live. I'm sorry about that.
Okay, we've got 2 more minutes. I think if you want to conclude now, Dr. Moodley.
Thank you for the opportunity. I'd like to thank Sada and SATA. It's a brilliant combination. I think we should all start working together, and so our members benefit, both the SADA and the SATA members benefit. And it's been an awesome experience. Thank you, Desiree, and the panelists for assisting with this webinar. I had so much fun researching for this. So thank you for the opportunity.
Okay, I would like to thank SADA for the opportunity that they've given us to use this platform. And I'd like to also mention that there are lots of webinars that are scheduled for the rest of the year. And one of the main virtual webinars that's coming up is the SADA Congress. I think the date that's set is for August, the end of August, from the 27th until the 29th. I would like to urge every one of you to register for this Congress. There are parallel programs that have been scheduled for dental therapists and hygienists. So thank you once again, Sada, and we really enjoyed working with you guys.